Are you someone who suffers or knows somebody who struggles with chronic pain? If so, you don't want to miss out this video. Hello fellow travelers, I'm Dr. Ru and welcome to my channel. In this channel, I talk about all things mental health with the hope to provide education and information. Join me as I dive into different topics every week. If you like the content that you hear, please don't forget to like, share, and subscribe to my channel. Your feedback is my way of knowing that this is helpful and give me the fuel to keep going every week with new topics. All of us at some point experience some type of aches and pains. In most cases, once the injury has subsided, the pain goes away. Chronic pain can start at any phase in our lives. In general, chronic pain is a type of pain that does not go away even after the healing process was completed. With chronic pain, the body continues to send pain signals to our brain. These become so disruptive, and it can limit the body's mobility and even make it challenging to get through simple daily tasks and activities. Depending on which article you read, classification of pain can fall into 3, 4, and sometimes 5 categories or subcategories. But in order to simplify, I'm going to focus on 3 different categories. Nociceptive pain typically relates to trouble in tissues reported to the brain by the nervous system, such as bone fractures. Neuropathic pain is a pain caused by nerve irritation. This is an actual damage to the nervous system itself, central or peripheral, either from disease or injury or pinching. Sciatica is a common type of neuropathic pain. And other pain without really obvious origins, but it's still pain that results from neurological dysfunction, not necessarily damage. An example would be fibromyalgia. Chronic pain can lead to other problems such as fatigue, loss of motivation, sleeping problems, isolation, depression, irritability, and anxiety. It can also have significant social implications such as inability to work and loss of relationships. This is hard. Pain bleeds into every aspect of your life. Many times, individuals who experience chronic pain will seek out various treatments to try to make the pain go away. Various procedures, medications, chiropractor visits, physical therapy are all various modalities of treatment. Some can be very helpful with reducing the pain, but not eliminating it. Many people who experience chronic pain continue to seek out the one magical solution that will make the pain go away. This is a very vicious cycle because the nature of chronic pain is the idea that the pain has no cure. Therefore, it is very frustrating for an individual with chronic pain to seek out different treatments, wishing the pain to go away. When the results do not match the expectations, depression increases and the person may lose hope. One form of chronic pain treatment is cognitive behavioral therapy for chronic pain. In many occasions, people come to treatment with the expectation that the end result will eliminate the pain. However, the very essence of cognitive behavioral therapy for chronic pain is to educate and set up realistic expectations regarding pain. This is a way to empower individuals who struggle with chronic pain and help them understand that chronic pain levels fluctuate. The pain is not severe all the time, and there are behavioral interventions that will essentially reduce the intensity of the pain so that they can continue to engage in their lives. I think one of the most common misconceptions is to become defensive about the idea that chronic pain is all in your head. It's not. This form of treatment is not designed to minimize the impact or the severity of the pain. The goal is to create space and allow someone to lead a meaningful life with pain. The first step involved is education. That is a way to develop an understanding about pain and the pain model. The way we feel in our body really triggers an inner dialogue, such as the pain will never go away, why bother trying, which then results in isolation, lack of physical activity, disengagement, this kind of behavior. Then it leads to, of course, the manifestations of feeling of depression, anger, frustrations. All these kind of feeling may come up. When we feel in such way, our thoughts spiral even deeper into this endless loop of negative thoughts, lack of movement, and loss of hope. We become afraid of movement, which stiffens the muscles, and we end up spending most of the day in bed. This leads to another vicious cycle, because when we don't use our muscles, we lose our ability to use them. We lose agility, endurance, and strength. That's when the medications come in. Oftentimes, people with chronic pain end up using medications as a way to use a short-lived relief, as a way to provide a way and try to do everything that they possibly can in the short time span. The way I think about it is very similar to trying to run a marathon without training. It leaves the body sore, hurt, and in a longer need of recovery. It really only perpetuates the fear of movement. Why move if I'm going to be in so much pain? Now, which approach do you think would be smarter? Running a marathon once a week, or running 5 miles every day, which is more than a marathon distance essentially? If you think about it, running 5 miles every day is a smaller chunk, and over time you build endurance, strength, ability that is required a shorter recovery time, and you achieve more in the long run. Pacing. This is part of the solution. When you learn to build endurance and work with your pain, you can achieve more. The book, A Day Without Pain, says it so nicely. The less we move, the more pain we have when we do move, causing us to move less. It becomes a vicious and painful cycle. The only solution for this, on-movement syndrome, is moving. Cognitive behavioral therapy for chronic pain encourages one to learn to move again and incorporate daily walking within a certain parameters that are reasonable and manageable. It also helps you learn how to use a healthy mindset that will restructure the way you think about pain so that you would not be as disruptive to your life. No, the pain will not go away, but you will learn how to live with it in a way that you can still enjoy your life, your relationship with others, and restore a sense of hope. One quote from Pain Recovery, How to Find Balance and Reduce Suffering from Chronic Pain resonates with me. It goes, anyone with chronic pain can live more fully as he or she learns to cultivate mindfulness, stress reduction, acceptance, and positive regard. These skills are developed like muscle and will eventually replace the old, worn-out beliefs of poor me, it's never going to get any better, I can't do it, that many with chronic pain live with. Practice these diligently and your life will change. Keep an open mind, because pain isn't the whole problem, and the absence of pain isn't the whole solution. The more you learn about your pain, the more you are able to empower yourself, make decisions that will instill hope, and change your life. I hope that you found something that was helpful for you today. If you like what you heard, don't forget to like, share, and subscribe to my channel. Help me spread the word to reach out to all those who needs to hear this message. Until next time, be well.